COVID-19, also known as coronavirus, is a widespread virus that causes a respiratory illness in humans, despite being originally found in animals. The spread of the virus was started by an outbreak in Wuhan, China earlier this year and has made its way to multiple other countries since. As of March 11, 2020, the World Health Organization has officially declared the virus a global pandemic. While all these terms are scary and have led to a bit of mass panic, most people don't need to fear for their lives. While those over the age of 60 and those with prior respiratory illnesses are at a much higher risk, everyone else will likely be able to recover from home. But for the sake of those people at higher risk, and for the sake of those that wouldn't be able to pay their bills if they were stuck at home with coronavirus, what can we do to prevent it since there isn't a vaccine? Today, we're going to look at the top 10 precautions you can take to prevent coronavirus. Number 10. Be aware of yours or a loved one's current condition. Be aware of your health, as well as your loved one's health. As we said in the intro, being over the age of 60 and having previous respiratory illnesses put you at a higher risk. But so do things like smoking or being around smoke, heart disease, and even diabetes. Making sure you're aware of who is at a higher risk is vital, so you all can take every step necessary to prevent contracting COVID-19. If you are at a higher risk, the Center for Disease Control recommends you keep distance from anyone who may be sick and have plenty of household supplies to get through a potential infection. Over-the-counter medicine for things like fever and cough, tissues for your runny nose, and a lasting stock of groceries are all things you need during this time. If you do contract the virus, it's best you avoid going anywhere whatsoever, but especially public places like a grocery store. Number 9. Stay up to date on your community. Stay up to date on your community. While you should be taking a lot of these precautions regardless of if someone nearby is confirmed to have the virus, it's especially important if you know someone nearby has the virus. There are multiple websites and Facebook pages that update how many people are infected and how many fatalities have occurred. And chances are, your local news will be updating you with similar information on your specific county or city. If multiple cases are confirmed in your vicinity, staying home as much as you can is recommended. And if you go out and about, remember to take all of the other precautions on this list. Especially, number 8, wash your hands. Wash your hands. Everyone should be washing their hands regardless, but especially in a time like this. Remember to use hand soap in warm water for 20 to 30 seconds. And use paper towels to dry your hands. Turn the sink off and open the door to avoid coming in contact with any more germs. Also, remember to use hand sanitizer if you can't wash your hands in any given situation, preferably with 60% alcohol or more. This is one of the most important precautions you can take, as doing this alone significantly decreases your chance of contracting the coronavirus at all. Number 7. Cover your mouth when you cough or sneeze. Cover your mouth when you cough or sneeze. This is another one that should be a given, but is extremely necessary in the midst of this pandemic. Coughing and sneezing without covering your mouth can release droplets of the virus into the air and potentially infect other people. Do not use your hands to do this, however, as this will just spread the virus on anything you touch afterwards. The proper area to sneeze or cough into is your inner elbow, so if you must sneeze or cough, do it there. This is another significant yet simple precaution that could limit the coronavirus spread even more. So please, build a habit out of this. Number 6. Avoid close contact. Avoid close contact. This applies whether you're sick, someone you know is sick, or someone in your community is sick. Staying away from people in high traffic areas is a huge way to limit the spread of coronavirus, especially if more and more people agree to do so. While some things necessary to do this can get expensive, it is possible to stay at home almost all of the time. There are services that deliver groceries to your door, as well as restaurants putting more and more of a focus on the delivery in the midst of this pandemic. You should also take the opportunity to work from home if this is a possibility for your job. any extracurricular activity that isn't an absolute necessity should be avoided at the time being, and most are being canceled anyways for this reason. Number 5. Don't touch your face. Don't touch your face. While some people are already aware of how bad of a habit this is, some fall victim to it subconsciously. Rubbing your eyes, scratching your nose, holding your forehead or chin while you sit, and so on are big no-nos, especially in the midst of a global pandemic. The germs potentially on your hands get wiped all over your face, which is not only just as disgusting as it sounds, but a pretty surefire way to give yourself coronavirus if you come in contact with it at some point throughout the day. Number 4. Call a health professional if you think you're sick. Call a health professional if you think you're sick. If you think you may be sick, don't panic. Hospitals and emergency rooms are currently being overrun by scared patients. They're busy, but can still help. Call a doctor before going to the hospital or emergency room and explain your situation, and take whatever the next steps they recommend are. While social media and the internet are helpful tools, false information is easily spread, and some people love scaring others for no good reason. Don't turn to Facebook or WebMD, just call a healthcare professional. Number 3. Clean and disinfect. Clean and disinfect. This is important if you aren't sick, and even more important if you are. While you have the coronavirus, anything you touch can be infected, and people who come along and touch those items after you can contract the virus as well. The easiest way to prevent this from happening is to clean and disinfect anything in your house others have come in contact with, but especially high-touch areas. Doorknobs, sink handles, kitchen counters and cabinets, and so on. Using cleaning solutions and disinfecting sprays on all of these things are recommended, and taking some Lysol wipes to your phones, computers, keys, and other small items you use frequently wouldn't hurt either. Number 2. Wear a face mask if you're sick. Wear a face mask if you're sick. While many people went out and bought face masks despite not having the virus, this isn't actually necessary. What is necessary, however, is wearing one of these masks if you do have the virus. While it can be difficult considering one of the major symptoms of coronavirus is coughing and shortness of breath, wearing a face mask for as long as you can handle is vital when you're sick, as this will also prevent any droplets of the virus getting into the air. While people are still recommended to stay in a different room at the very least, wearing the face mask will allow them to safely come in contact with you to bring you medicine or food if needed. And number 1. Stay home if you are sick. Stay home if you're sick. The single best thing you can do if you contract the coronavirus is to just stay home. Of course, you need to be taking all of the other precautions as well to protect yourself and your household, but simply not leaving the house will stop the spread of the virus within your community. Do not go to the grocery stores or restaurants, and do not go to your school or place of employment. While this can be frustrating and lonely, going to any of these areas puts tons of people at risk and prolongs the spread of the virus even more. While a lot of these things are simple, healthy habits we should all have built anyways, they are the steps we need to take to prevent coronavirus. Hopefully this puts the situation into a more realistic perspective, as the media loves to blow things out of proportion and cause fear. Most of us won't even get coronavirus, and if you do, you should be able to recover from home. Remember though, some people are at a higher risk of death, so stay safe and stay healthy, especially for those people. More information on the coronavirus can be found at the websites for the Center for Disease Control, the World Health Organization, and DHEC. If you enjoyed this video, please leave a like and don't forget to subscribe.